Welcome to the Live Well podcast, where we explore how to navigate life's biggest changes, overcome challenges, and build a future that aligns with your values and your goals. Hi, I'm Matt Wilson, financial advisor, coach, and business owner of my practice here at Cornerstone Wealth Services in South Bend, Indiana, and I'm so glad that you're here. Today, we're diving into a topic that so many either dread or feel completely confused by: Medicare. What is it? How does it work? And most importantly, how do you make the right choices without being overwhelmed? And like it or not, it's going to be part of your life. So I'm joined by my friend and Medicare expert, Kyle Moore from Aldridge Insurance, right here in South Bend. Aldridge Insurance has been serving our community for over 30 years, helping families and businesses with auto, home, life, and of course, Medicare. Their whole mission is simple: clarity and personalized service. And Kyle, that's exactly what we need for today's conversation today. So welcome to the show.
Thank you. Like you said, my name is Kyle, born and raised here in South Bend, and I've been in the insurance industry for 16 years now.
That's great. And, Kyle, let's start at square one. When we look at Medicare, for somebody who's never dealt with it before, what exactly is it? Who qualifies, and why does it even exist?
Yes. So Medicare is health insurance. Quite honestly, original Medicare is great health insurance. I would take it. I'm in no rush to turn 65, but I would take Medicare if it was available to me. Health insurance for people 65 or older. Some cases, people on disability will qualify for Medicare as well. Medicare was rolled out in the 1960s. Before Medicare rolled out, less than half the senior population at the time had any health insurance at all. They just didn't have access to it. You had Social Security roll out maybe 30 years before that, but even though they had Social Security checks, nobody had health insurance. So just a way to try to help that population have access to health care.
So it was created years ago, 1965. Over time, it's kind of become a little bit of an alphabet soup, right?
Yeah.
Parts A, B, C, and D, and others. So can you break down what each of the parts mean and how they work together?
Absolutely. Yeah. A lot of letters. So that can throw people off and be overwhelming. So we go through that. When someone first goes on to Medicare, they're going to sign up for A and B through Social Security office. I believe they let you sign up online. You can go there, phone call. There's several different ways to do it. What A and B mean? So Part A is the coverage itself is hospitalizations, emergency room visits. Hospice care is actually included in Part A as well. There's generally not a cost with Part A as long as you've worked at least 10 years in your life, or your spouse has worked 10 years in your life. You've paid your taxes your whole life. That's what's getting you Part A. So Part A is generally free of cost. If you don't have that work history, or if you've only been in the country for a couple years, maybe you've only worked 5 years, and then you would have a cost for Part A. So it depends on your working history. So we can talk about that too. Part B is everything else. So Part B is your normal doctor's visits, your wellness checks, your specialist, in-home health care, medical equipment, things like that you may need. Part B does have a cost. So this is part that sometimes surprises people. Outside of someone who's low income who may qualify for no cost, Part B is income-based. So there's a thing called IRMAA with an I. Based on your income is how much you pay for Part B. And there's charts, and they do change every year. So the cost can change. But that's something real specific to you that you would look up as far as exactly what B is going to cost you. So again, everybody starts with A and B, and then you have some options beyond that on what you start to do. So next, C. C is an Advantage plan. Advantage plans are pretty much the ones you see all the commercials about. Depending what you choose, not everybody has an Advantage plan, so you may never have a C. It depends what option you go with. The amount of plan C's out there, the amount of Advantage plans out there are huge. There's tons to choose from. So there's lots to look at, tons of different companies that do it. So you've got a ton of options there. D is probably the easiest to remember because D for drug plan. So that's a separate prescription drug plan. Also, several to choose from. They are zip code based, similar to Advantage plans. So depending where you live, it lets you know what plans are available to you. And as I said, A and B go together C and D generally do not. So you're not going to have all those letters. You're either going to have a C or a D. Very rarely would you have both.
Yeah. Yeah. Well, you know what they say about assuming that, you know, and I didn't want to assume that people understand that or know it. And so I appreciate you walking through that. Now, there's a lot of things that we hear about Medicare. There's a lot of assumptions, like we said. But what are some common myths? You know, I hear people say things like, oh, Medicare covers everything, or it's totally free. You already kind of addressed a little bit about that, but what other misperceptions are there out there that people run into?
Yeah, the free one comes up a lot when people start to look at the actual cost of it. It's definitely not free. Some situations, like I said earlier, low income households, people that qualify for Medicaid, those do have plans that could be free. The companies generally tell you what you qualify for, so that's something that can be looked up. But yeah, Medicare is definitely not free, and like I said, it's income based. So if your income grows or things like that as time goes on, it could actually get more expensive as that happens. We also get a lot of people who think, you know, they're 65, they're going to continue to work, which is common nowadays. Not everybody's retiring at 65. A lot of people want to continue to work either out of necessity or they just like what they do. And they think Medicare is going to be worse. The original Medicare especially is going to be worse than their work plans. And in a lot of cases, that's not true. In many cases, someone can continue to work past 65, but they can go on Medicare, and Medicare can be less expensive and less out of pocket than they had with their work plan. The networks can be bigger too with Medicare than your work plan. So those are all things to talk about with somebody to see if it makes sense to switch or stay where you are.
Yeah, I think it's around 22% of people 65 and over who still actively work. So that's a really good point to bring up. So let's talk about coverage, costs, and that donut hole that everybody hears about. So one of the biggest surprises that people get is the cost. You know, Medicare isn't exactly free, you know, like we've already touched on. There's premiums, there's deductibles, there's co-pays. Kyle, what should someone realistically expect when it comes to the costs?
Yeah, cost in two ways. So, and we really push this when we talk is, it's not only the cost of the plan, but what are the co-pays? What are the max out of pockets? What does the out of network mean? So those are things to really looking at. So it's not just the cost of the plan. Like I said, Part A, generally no cost for people because, again, you've paid for it. You've already paid for it in your taxes. So it's still not free. You've already paid into it. And then the cost is different depending if you don't have that working history or not, but it's less every year. So someone that has 9 years of working history is going to pay less than someone that only has 2. So it's a sliding scale. But yeah, deductibles, hospital visits, they all have really, really different, all the plans have really, really different out-of-pocket potentials because you might not meet that out-of-pocket every year. So we talk a lot in worst case scenario. Obviously, if everything's good, you won't reach that. But here's the worst that could happen next year. We try to really push that so there's no surprises when it comes with it.
Yeah, I think it's really important just to make sure that people know the expectations, right?
Yeah.
You know, you don't want them coming back to you next year being upset with, oh, I thought this was covered, or, you know, I didn't know that I would have to pay for this or that or whatever. And it's the same thing in my business. You know, not everybody, there might be plans that are better than others, or there might be something that you think is really beneficial for them, but can they handle it? Can they absorb it? And really, it's no different than if somebody comes in and wants to invest money and they say, hey, look, I want to make X return. Well, are you able to handle the road that it's going to take to get there? And so everybody's a little bit different. Everybody has, you know, different financial concerns and different income. So it's really just a question of, hey, what can you expect? And if we can just give a little clarity to that, it sounds like that's what you do.
Right? Yes, absolutely. Like I said, we like to set, we hope the worst doesn't happen. None of us do, but that's why you carry home and car insurance and everything else. You don't want to have to use it, but it's there if you need it. And some things have improved. So like the donut hole you mentioned, that was a really complicated way that the government has set up. with how drug plans work, where your costs can kind of go up and down during the year, which has since gone away. So that's the good news, is you don't have to worry about it anymore. But yes, absolutely. You need to know, not every detail of the plan, but at least kind of the 30,000 feet view of it. So you just don't want to you just don't want to be caught by surprise on a lot of things.
Yeah, that's good news. And again, as of 2025, the donut hole no longer exists, right?
Correct.
So what are some smart ways that people can plan ahead so that those prescription costs just don't take such a big bite out of their retirement budget?
Yeah. Meeting ahead of time, because that way, again, you kind of know what you're getting into and know the actual cost of the plan. So, for example, some of these drug plans, the premium might be really low, maybe as low as $0, which sounds really appealing if that's all you saw was, hey, this plan is $0 a month. Why in the world would anybody take anything else?
Yeah.
The issue is that your monthly prescription on that $0 plan could be, $50 a refill, where there's a plan that's maybe $30 and the prescription is $2 a month. So you have to look, we call it your all-in cost.
Mm-hmm.
And we can show all this to you, but someone that takes, and we've had people do the opposite. Actually, the most expensive plan out there, and that does cover, some high-priced drugs. Once or twice, not often, I've had somebody tell me, well, I took that plan because it was the most expensive, so that means it's the best, right? And not at all. It's the most expensive because people that take that plan are on some very expensive drugs, but this person wasn't on anything. So I was like, you took an expensive plan. You have a drug plan, which is great, but you're paying a lot more than you need to because you don't take the medications that really fall in that plan.
So let me ask you this. If somebody, say they're really healthy, they don't really take anything, but that can change, right? So what happens then if they have to take more expensive drugs? What do you
Yeah. So couple things. The plan. So this is why the fall is a big deal during open enrollment. You can change your prescription drug plan every year without consequence. There's no hassle to it. You're just signing up for a different plan. And that's very common. That's a lot of what we spend the fall doing, because what worked for you in 2024 and 2025, even if you don't change your prescriptions, the plans can change. So this plan, whatever plan you on, could all of a sudden say, we no longer cover that medication. We cover a different version of it. So this plan isn't going to be the best fit for you anymore. We also get to the case sometimes where people, like you said, if they don't take anything, why take a plan, right? Because why pay for a drug plan you're not going to use? But the government's really good at that, where they will penalize you for not taking a plan. And so you will pay. So it's a 1% a month penalty. It's 1% of the average cost of the plan. So that tends to grow as time goes on, but it's a for life penalty.
Yeah.
So it never, ever goes away. So if you even go 1 year without a plan, now you're paying 12% more for the rest of your life for that plan.
Yeah. And that can add up over time.
Yes.
So, yeah. So supplements and the Advantage plans, Medicare is kind of like the base model of a car,
Correct.
Right? You get coverage, not everything's included, supplements, and the Advantage plan comes in at that point, right? So Kyle, can you explain the difference between a supplement, which is Medigap, right?
Mm-hmm.
And a Medicare Advantage plan?
We talked about earlier. So everybody kind of starts with A and B, sign up for that. And then you really have a direction to go. You're going to take a supplement or you're going to take an Advantage plan. You're not going to take both. So the supplements, those do have a monthly cost. There's a premium with them. As everything else in our lives, generally that premium is going to go up as time goes on. And then on the flip side of it, though, so you're paying this monthly premium, but their out-of-pocket expense is very, very low. It's $257 right now, I believe. So that's $257 max out-of-pocket a year for your health insurance. So whether you're getting knees replaced, hips replaced, anything like that, once you hit that $257, you don't pay anything else for those types of surgeries. So you can really budget your whole year with a supplement because you kind of know what your expenses are going to be, or worst case. So out of pocket's very low. And the other thing with supplements too is when you're on a supplement, you have original Medicare. Medicare is still paying the majority of your bills. Supplements pick up the deductibles and things like that come with Medicare, because Part B has an unlimited deductible. There's no cap to it. It's just a percentage. So again, your supplement's paying that. But I think it's about 98% of doctors across the country take Medicare.
Yep.
So if you want to go see the best guy for your shoulder or your back or whatever the case is, generally you can go to them. So, Mayo Clinic, Cleveland, Houston's got a good clinic. So you can go to any of those. Transportation's on you, but you can go see the best if you want to see the best. Or if you're fine staying local, then you can stay local and see who you want to. But the people like choices, people like options. This gives you those.
Yeah, I've had clients multiple clients that have gone to Houston for various surgeries and things like that. And, to your point, if you want to see the best, you can. So when you're choosing a plan, it can feel overwhelming. Again, alphabet soup. And again, the fall, October 15th starts the period where you can make changes, right?
Yeah.
And so it goes from October 15th to
December 7th.
December 7th every year. So different letters, different costs. How does somebody begin to make that decision?
Yeah, so it can be a lot. I've definitely had people cry in my office because it's overwhelming with everything that they're thrown at them through advertisements and just the stuff they get in the mail. They don't know what to do. They don't know what to expect.
Yeah, I want to talk about that too, because there's a lot of that out there.
Yes.
Scams and...
Absolutely. Yeah, we'll talk about those. And honestly, a lot of people, you've had your work plan for, your whole working life.
Right.
You never really messed with it. You never really questioned it because it's what work provided. It was kind of your only choice and you just went with it. So this has a lot of choices, but what I like to do is generally I'll meet with somebody at least 2, maybe 3 times before they choose a plan. So we'll meet with people months, maybe a year or 2 even before they turn 65, just so they can kind of get a feel for it. And honestly, feel better about what they're getting into, because it is good insurance. You won't find a plan that beats it. But there's so many unknowns, and does it work? And am I going to be stranded somewhere when I need certain health care? So the plans themselves take care of people, but I do really enjoy talking to them early and not. I always tell people when they first sit down, we're not deciding today. I'm just letting you know what's out there, and then second or third meeting, you can start to decide which one works for you.
Yeah, that's a great point. And I think that if you have a process to really hone in on what's best for you, it's very similar to our 3D process here. And we have a discovery, design, and deployment process. So the discovery phase is just that. It's sit down and let's talk about your goals. Let's talk about your preferences. Is there something you like or don't like? Is there anything you want to stay away from? And so it's really just discovering truly what's important to them and what they can handle. And then the design meeting is very much, hey, let's get feedback. Here's what I think. I just want to get feedback from you on what you think. Yeah. What do you like? So it sounds like you operate very similarly there. What are the common mistakes that people make, and how can people avoid them?
Yeah. Common mistakes. Well, one would be, like we talked about, not signing up for things you should when the time is available, because Medicare is very specific on their dates. So you do want to do certain things by certain dates, and we can talk about that depending on your situation. But because Medicare is run by the government, they're not very forgiving on their dates. So if you miss your date or you miss your window of opportunity, generally there's a way to get in, but it may be delayed. You might not get it till the 1st of next year, for example, depending on the situation. So start talking about it early or researching it early, however you choose to do it. Like I said, because they're very, very strict on their dates, even for agents. If we miss a date for somebody, there's not a grace period. So it's not like we can call and ask for a favor or anything. It doesn't work that way.
Yeah. So I think we were talking about this a little bit earlier too, that there are certain plans that are pushed more than others.
Yeah.
I don't know if you can speak to that.
Yeah. So all the commercials you see, so we talked about, like I said, supplements, we got in those details, and then Advantage plans. That's the commercials you see. That's 99% of the mail, if not 100% of the mail you get it for Advantage plans. that those do get pushed really hard by agents across the country. And they're very appealing on a brochure because Advantage plans are going to say $0 for health insurance. Well, that sounds great. What people, and this is what I found in dealing with people, is they all understand the zero premium very well, but they don't understand what that plan actually is. So a couple things that go along with any Advantage plan. One is there's, like I said, a supplement's got an out-of-pocket of that $257. An Advantage plan is going to be in the thousands. Just depends on the plan.
Yeah.
Last year, I think the lowest plan we came across that worked for most people was about $3,700 a year, and you see them as high as $10,000. So generally, when I ask somebody on their Advantage plan, what's your max out of pocket, they don't know. They were never told. So we do try to, and we can pull up the plan so we can tell them. But the other thing, putting money aside for a minute, is when you're in Advantage plan, no matter what company is, you're in that company's network now. So you do have to see doctors and specialists that take those plans, and not everybody does. So we mentioned, going to Houston and things like that. They don't take a lot of Advantage plans, if any. I think maybe they take some now, but it's few and far between. So you do have to understand that you're going to be a little bit limited in your health care, or paying out of pocket for it. If you want to go see a certain doctor, or if your friend tells you that this doctor is the best guy at this, they may or may not take your plan. So you have to call and check on that. Not only do you have a network, but you're giving the plan the power to say no. So even on a small scale, like the doctor may want an MRI on your back, and the plan can say no, or the plan can say, well, have we done physical therapy for 6 weeks? And then let's see if his back still hurts. So they can put kind of obstacles in the way of getting things done. One story from our office, it sounds extreme, but it absolutely happened. There was a gentleman, he's in his mid-90s, healthy guy, mowed his own yard, drove his own car, lived alone, healthy as could be for his age group. He had an Advantage plan. So he went into the hospital for a heart procedure, local hospital. Heart procedure was successful, got done what they needed to do. He developed an infection very shortly after, so kept him in ICU over there. Now, the doctor told the family, if this was a frail person coming into this, I would not have a lot of hope. I don't know that this is going to be a great outcome. But I met this man before. We had conversations. He's in great shape for his age. Cautiously optimistic is the term the doctor wanted to use, that let's keep fighting, because I think we, can't promise anything, but hopefully we can get past this infection. So, of course, the man's family is all for it. Shortly thereafter, his Advantage plan, they had a rep that worked in the hospital, came to the room and said, we've done all we're prepared to do. As of midnight, tonight or tomorrow, whatever deadline they gave, we're not paying for this anymore. So either you can cover the cost of ICU per day, which nobody can really afford, or he has to be bumped down in care to kind of more of a general care.
Yeah.
And the man ended up passing away a few days later because he was moved down. He wasn't able to stay in ICU. And he may have passed away anyway. Who knows? But the point of the story is the family and the doctor both wanted to keep him where he was, and the plan said no. So that is something that you just have to be prepared for, or know that's a possibility with certain plans. Advantage, original Medicare and a supplement, they don't have nearly the pre-authorization that Advantage plans do. So again, I don't want it to ever sound like I'm bad-mouthing the plans. I just want to set expectations with people that this has happened, this does happen, and I want you to be prepared for it.
Before we continue, I want to remind you, the listening audience, that financial wellness is about more than just Medicare. Whether you're a business owner, a pre-retiree, a family looking for more clarity and confidence, I can help, and I'd love to help. As your financial coach and fiduciary advisor, I'll help you design a plan that truly aligns with your goals. You can learn more at mattwilsonfinancial.com, and you can see our process that we go through with our clients. And that is to discover everything we can. We design a plan for you. And then we also talk about the steps to deploy the pieces for that. And then we walk together with you through your financial life. So you can reach me again at mattwilsonfinancial.com. I would love to hear from you. So So let's get back to the show here. Kyle, let's talk about timing and important dates.
Yeah.
We touched on this a little bit. We mentioned the October 15th open enrollment or annual election period that starts. AEP is what you might see. So what are the dates and especially the first enrollment period at 65 in that annual window?
Yes. So your first enrollment period is generally going to be when you turn 65. So obviously people turn 65 every day. So your plan might start in March or June. It's going to match your birthday. It usually starts the month of your birthday, the first of that month. And I would just highly recommend everybody go 2-3 months ahead of time or earlier if you really want to know. Either start researching or sit with somebody and say, what will this look like for me? Because everybody's situation is different. I am retiring at 65 or I'm not retiring at 65. So should I just keep my work plan? So those are things to look at. And like I said, people can help you review the pros and cons and what makes sense for you.
And what happens again if somebody misses that enrollment period?
Yeah, if you miss the enrollment period, there's potential you could be without coverage. Generally during the fall, you can get a plan, but they usually start the first of the year, so it can still be a while if you miss the enrollment period. And also, if you miss your enrollment period, even if everything goes great, you're healthy, so you never need a doctor anyway, the plans available to you might not be the same at 65. So 65 is when everything that Medicare offers is available to you, but that may not be true going forward. So you want to at least look at it at 65 so you have everything in front of you and can kind of take your pick of the litter and don't miss the date. Like I said earlier, the government's very, very strict on their dates. They don't do grace periods.
There's also a lot of conversation out there about Medicare's future, budget shortfalls, possible cuts. Should people be worried? And what do you say when clients ask you about the long-term stability of Medicare?
Yeah, I definitely believe Medicare is here to stay. I don't think the program itself is going anywhere. I think it's too big to fail. I think no politician would ever run on a platform that says let's do away with Medicare, but they will. The cost is, I mean, as everything else in our lives, the cost is probably going to get more expensive for no matter what plan you choose, or even if you have a plan that's zero, the out-of-pockets are going to start to grow. They're going to increase your portion of it. One thing that happened, because even when the government tries to help, they kind of mess it up. Inflation Reduction Act a year or two ago when that came out, the nice thing, the part that got advertised was, hey, did away with the donut hole for drug plans. We are maxing your out-of-pocket expenses for prescriptions at $2,000 a year.
Yeah.
Most Americans were not there anyway, but those that were, that's a great deal for them. That's a huge savings.
Sure.
But because all these companies are in business just like everybody else, they said, okay, if we have to limit what we can collect for the plans themselves, for the copays and drugs, the cost of the plans got more expensive than very soon after.
Yeah.
They kind of treated agents a little bit differently. But your what used to be zero might be a couple more dollars. So they're going to make up for it. So even when somebody does step in to try to reduce cost, the plans are going to kind of circumvent those and find a way to stay profitable.
Yeah, that's really helpful. And they couldn't get rid of the government Obamacare, as they call it.
Right.
I highly doubt they'll get rid of Medicare or Social Security. I mean, anything can happen, but I'm in your camp. I just don't see how they could ever possibly get rid of it. I could be wrong, but I see that as very low possibility there. So many of our listeners are not just thinking about their own Medicare. Maybe they're helping their parents navigate it. Maybe they just have taken that role in their family. And I guess if you're an adult child trying to help your mom and dad, where do you start?
Yeah, a couple places to start is try to know what plan they have. One good way to do that, I mean, obviously you can go to their agent who wrote it. They can tell you. Or Medicare.gov, and I stress .gov, not .com. .com's not what you want, but Medicare.gov is the government website. You can make a login. Your parents can make a login. It'll show you exactly what they have. It'll show you their history of plans, if they've changed plans over the years. If a plan expired for some reason or they canceled it, it will show you on Medicare.gov. So you just got to make a login. So that's a huge help. The other thing, and this is true for everybody, especially our parents, there's a lot of fraud out there, and there's a lot of it's legal, but it shouldn't be, of ways that they can have people switch plans without them realizing it.
Wow.
A lot of the fraud calls, and for some reason I get them on my phone. So somewhere I'm on a list of I'm 65 and older. So honestly, I get 20 to 30 calls a day on my cell phone of Medicare fraud calls. So maybe it's God's way. So that way I know what's going on in the world for my line of work. But they'll call and they'll say, "Hey, have you got your new Medicare card?" Well, that's a lie. There's no new Medicare card. Or they will call and they will call and say, "You're missing out on this benefit," whatever that benefit is, dental insurance or free rides to the doctor. Those are all true things, but what they're actually doing is they are moving you from your plan to another plan, and they can do that over the phone. They allow voice signatures now. So saying yes over the phone, so people lose their plans and sign up for new ones without ever signing a piece of paper. So the guy in our office talks about this, but he pretty much says any inbound call or inbound email you didn't ask for, be really hesitant to engage at all with them. Medicare doesn't, just like the bank, Medicare's not contacting you. So Medicare has a number. You're always welcome to call them and say, "Hey, are you trying to get a hold of me?"
Right.
But I would never do anything with an inbound phone call or pop up on the internet. Anything like that generally doesn't lead to good. And we do help people. We get a couple a year who have been, for lack of a better word, tricked out of their plans. They didn't realize they switched. Especially taking them to a plan that had maybe, $200 and some out of pocket to $8,000 out of pocket. They get all these bills all of a sudden. They don't know why. It's because they took a phone call they shouldn't have. So it's legal in a sense, but it's not ethical at all, and it's really heartbreaking sometimes because not all of those things that happen to people are fixable. We do our best, but sometimes they get stuck with what they got tricked into.
Yeah, that's really sad. And, unfortunately, people just aren't aware of it. So my general rule of thumb is, look, don't give any of your personal information unless you called them.
Right.
If somebody calls you, organizations are not going to ask for your information if they reach out to you. So I would just be very careful. Like you said, I would stress that. Don't give your information out. I don't give my personal info out unless I made the phone call. And that's been a pretty good rule, I think, for most people. So initiating the contact is an important barometer, I think, in the scam. The other thing I would say is, hey, if you're a child, you're trying to help somebody with Medicare, this is a great way. Or somebody who's trying to help their parent. This podcast is a great place to start. Listen to this, and you'll get really all the information that you need. And I would encourage you to subscribe and then to share this with folks that you think might be able to benefit from this. So I appreciate you coming in. This has been a fantastic an educational period. It's not the most glamorous and exciting, but somebody has to do it. And whether you like it or not, Medicare is going to be part of your life, like you said earlier. So it's been very helpful. Kyle, Medicare is complicated, but you have definitely shown us that with the right guidance, it doesn't have to be overwhelming. So before we wrap up, where can listeners reach out to you if they have questions, need help, or if they're ready to purchase a supplement plan?
Yeah, absolutely. The best way is just give me a call. We'll set up, happy to do it over the phone, but generally we meet in person. I can come to you. You can come to me. Office phone number at Aldridge Insurance, 574-232-9999.
Yeah, and we'll make sure to put that in the show notes as well. And then what about states? Do you have ability to?
Yes, Indiana and Michigan. We actually also have guys in our office who do Texas, Florida, because we have snowbirds and people move to Florida and things like that from here. So we can usually help you even if you're leaving Indiana.
Okay. Awesome. Fantastic. Well, we'll put all that information in the show notes, like I said, and be sure to check that out. And for those of you who are listening, thank you for joining us today on the Live Well podcast. Remember, you can listen on any platform, but you can also watch full episodes on YouTube as well. If this conversation was helpful to you, then please subscribe, share it with a friend, and leave us a review. It really helps spread the word. If you'd like us to help with your financial plan, again, visit me at mattwilsonfinancial.com. Until next time, live well. Securities and advisory services offered through LPL Financial, a registered investment advisor, member FINRA SIPC. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.